días y muy bienvenidos al webinar de la Organización
Good morning
Panamericana de
and
la
welcome
Salud
to the
para
webinar of
celebrar el
the
Día Internacional de las
Pan
Personas
American
con
Health
Discapacidad.
Organization
Este
to
es su webinar
commemorate the
direct de
Day
la
of People
Unidad
with
para la Prevención
Disabilities. My
de
name is
Discapacidad
Silvana
frente a la
Luciani,
violencia
head
sobre personas.
of
Y es un placer estar
the
hasta aquí e
Unit
iniciar con
on
este webinar.
Non-Communicable Diseases
Tenemos
and
traducción
Prevention of Violence
simultánea,
and
así que
Trauma.
aunque
We
el
have
webinar será en
simultaneous
inglés y en
interpreting
español,
because
solo
the
hay que
webinar will be in
elegir el
English and
idioma para
Spanish,
la
and you
interpretación.
just have to
También
choose the
tenemos
language
subtitles, así que para
for
acceder al sign
interpretation. We
language
also
solo
have
hay que
sign
ver en
language,
el
and
view,
to
en
access to
el
it,
Zoom,
the only thing you have to
gallery
do
view,
is
pinche en el gallery
to
y se
to
puede
check the
ver el
gallery
slide
view.
con
You
diferentes de
just
las
click on gallery
presentaciones.
view, and you can
Bueno, para
access it
iniciar
besides
esta
the
sesión
presentations.
tenemos a
To
nuestro
start the
director de la
session, we have
organización,
our
Jarvis
PAHO
Barbosa,
director,
para
Dr.
darnos
Jarvis
algunos
Barbosa,
datos.
and
Él
he
no puede
will
estar
address
aquí
the
con
floor. He
nosotros en
can't be
persona,
here
solo
with
nos ha
us in
mandado un
person,
video de
but we
presentación
have a
por correo.
video
Así
from him.
que iniciamos el
So we
webinar.
get started. We're commemorating the International Day of People with Disabilities. The Pan American Health Organization joins the global community to reaffirm our commitment with equality, inclusion, and dignity of all people. The topic of this year is fostering inclusive societies for people with disabilities so as to promote social progress. And PAHO promotes the inclusion of people with disabilities in education systems and in public policies. At the same time, it defends the rights and well-being of that population. That also reminds us the numerous benefits generated when we tackle with the needs of the health of people with disabilities, and we guarantee their participation in all acts of political, social, economic, and cultural life. Um, 19% of the population lives with some kind of disability. The global evidence shows that people with disabilities can die um, several years before, and they have twice as much the risk of having diabetes, depression, or ACVs or CVAs. Also, access, they can face up to six more difficulties to enter health centers, hospitals, and 15 times more obstacles to access transportation. Closing those gaps requires to transform health systems so they are truly inclusive, accessible, and people-centered. In that effort, PAHO works together with countries, ministries of health, specialized secretariats, and representative organizations in developing policies, action plans, and technical tools that strengthen equity in access to health services of people with disabilities. It's not only a technical standardization component, it's an expression of justice, dignity, and human rights. We renew our commitment and continue building together inclusive health systems that are accessible, resilient, and equitable, guided by the conviction that no one should be left behind. Not today,
Muchas
not
gracias, Dr.
ever.
Jarvis
Thank you very
Barbosa,
much, Dr.
director de la
Jarvis
OPS,
Barbosa,
mostrando su
PAHO
apoyo y
director,
palabras
showing
para
his
este
support
Día
in words
Internacional de
for
las
this
Personas con
International
Discapacidad.
Day
Y
of People
estamos
with
muy emocionados de
Disabilities. We're
tener este
very
webinar hoy día para llamar atención
enthused
sobre las
about this
brechas en
webinar today
discapacidad en
to
las
call your
Américas,
attention
así como
on the gaps
presentar
we
la nueva
have
guía de
concerning
acción
disabilities
para
in the
promover la
Americas.
inclusión
And
de
we're
las
also
personas con discapacidad
presenting
en
a
las
new
políticas
action
y los
guide
servicios de salud.
so we prevent
I
their
will switch now
exclusion
to
and
English and
policies
just
and
welcome all of
health
you to the
services.
PAHO webinar
Ahora
on health equity for persons with disabilities, a guide for action. I want to begin by just thanking all of you, representatives from governments, health professionals, community actors, and all of those who feel very passionate about disability inclusion and working with us and sharing your time with us at PAHO today while we present the Health Equity for Persons with Disabilities Guide for Action in the region of the Americas. This guide really is a major step forward to help advance our shared vision of inclusive health systems that recognize, respect, and respond to the diverse needs of people living with disabilities. We know that there's approximately 16% of the population in the Americas region that lives with a significant disability, affecting their quality of life and their well-being. This is millions of people that have great needs for health equity. We also know that disabilities are increasing rapidly due to the aging population in all the countries in our region, the rise in non-communicable diseases, as well as other factors that impact the functional abilities of people. So we know that we have millions of people that today need to address their needs for disability inclusion and health equity, but the numbers will only increase with time and the needs will only grow with time, which calls attention to the need to act now to help reduce some of those significant health inequities that people with disabilities live with. And we know that there are many health inequities, like more people die at an earlier age with those living with a disability. They experience poorer health outcomes because of many of the barriers they experience in health service access, and they encounter greater limitations in functioning. And many of these facts of the health outcomes and health disparities in people with disabilities were revealed in our previous webinar that we had earlier this year in March, where we highlighted many of the regional issues of persons with disability from the Global Report on Health Equity for Persons with Disabilities. And that global report contained many recommendations on how to advance health equity for persons with disabilities. And those recommendations have now been adapted to this very practical guide, which we will present today, the Health Equity for Persons with Disabilities Guide for Action. The guide's a really important planning tool, developed with input from many, many stakeholders. Perhaps many of you connected to this webinar were involved in its development, and we thank you for that and your contributions. But the guide provides very practical guidance on how to integrate disability across health system strengthening efforts using a primary healthcare approach, addressing the health inequities faced by people with disabilities, and contributing to national health priority setting for persons with disabilities. And we're really pleased that the guide has already begun to be implemented, and some of the early results are revealing the benefits of using this guide for action. It helps to better understand what is the situation and what are the needs of persons with disabilities in your country or your community. It provides an overview of the health inequities that they experience and the drivers of some of these inequities. And it helps to address some of the system level gaps in service delivery, emergency response, and public health interventions. And the Guide for Action responds to many of the objectives outlined in several important global resolutions, including the World Health Assembly Resolution on Disabilities, on the Convention of the Rights of Persons with Disabilities, and of course the Sustainable Development Goals, particularly goal number 10 and 11, among others. So the guide will really help us to ensure that persons with disabilities are included in programs that address health determinants. And it emphasizes strengthening primary healthcare approaches, overcoming some of those system barriers that people with disabilities face in accessing services. And it will also help us ensure that during emergency health situations, like natural disasters or other health emergencies, that the access to essential health services is sustained and equitable for everyone, and especially those living with disabilities. So let us learn more about disability inclusion and this guide for action in today's webinar, where we have a panel of distinguished speakers who will introduce the key components of the guide and also share some experiences with its implementation. I hope you really enjoy the webinar today. Thank you. And now I'd like to introduce my colleague, our Regional Advisor for Disabilities and Rehabilitation, Dr. Gustavo Perez Reina, who is going to talk a little bit about the guide and about the webinar. Over to you, Gustavo.
Muchísimas gracias, estimada Silvana, por tus palabras de
Thank you very
apertura.
much, dear Silvana, for your opening words. Thank you very much to Dr. Barbosa, Director of the Pan American Health Organization, for his introductory video. I think Silvana has already given us a very clear idea of this evaluation tool to analyze the capacities and needs of a country to reinforce their health system to make it more accessible and inclusive for all. In March this year, we
español también el
published
informe mundial
in Spanish
de
the
gafas
Global
de salud
Report on
para
Equity
personas
in
con
Health
discapacidad.
for people
Pues
with
bien, unos cuantos meses
disabilities.
después hemos
A
conseguido
few months
también
after, we
traducir al
also
español la orientación,
translated
que yo
into
creo que es la
Spanish,
herramienta
translated the
fundamental
action
para
guide into
poder dar
Spanish, a fundamental tool
claves a los
to
países de tal manera que como hemos
provide
dicho
keys to
anteriormente,
countries
podamos
so
llegar a
that
fortalecer
we
los
can
sistemas de salud de los
strengthen
países, haciéndolos
their health
más
systems,
accesibles y más
making them more
asequibles,
inclusive
especialmente
and
para las
more
personas con
accessible,
discapacidad.
particularly for people
Hoy
with
nos van a
disabilities.
estar acompañando
We're
dos
going
colegas
to
de la
have two
Organización Mundial de la
colleagues
Salud, la
from
licenciada
the
Melanie Grove del programa
WHO,
de
Melanie
discapacidad de
Grove
la
from the
OMS,
Disabilities
así como la
Program from
representante de la Organización
WHO,
Mundial de
and
la
the
Salud,
representative of the
Mina
World
Bradovic
Health
de
Organization,
Montenegro.
Dr. Mina
Este
Bradovic in
programa, esta
Montenegro.
guía de acción, se
This
ha
action
pilotado en
guide and
varios
program
países de
have been piloted in
prácticamente el
several
mundo,
countries in the
específicamente en
world,
Montenegro.
and
Y
particularly
creo
in
que va a ser una
Montenegro.
oportunidad
And I
muy
think it'll be
interesante
a very
para
interesting
que todas las
opportunity
organizaciones y
so
participantes
that all
que van a estar
organizations and
presentes en el webinar
participants present in
entender
this webinar
cuáles han sido
to
pues, los
understand
procesos que se han llevado a cabo
the
y cómo se ha
processes
reaccionado en el
that
país a la
have been
implementación de esta guía.
taken into
Creo, por
account
tanto, que estamos ante una
for
oportunidad muy
um,
interesante
drafting and implementing
porque
this
esta
guide.
guía de
So it's an
acción no está
interesting
disponible
opportunity.
solo en
This
inglés, está
action
en
guide is
español,
available in
en
English and
nuestra página
Spanish
web
and
y está
on
disponible
our
compartida
website.
también el
And
código
I'll
QR
also
donde podéis
share the
acceder
QR
a cualquier
code for
documentación.
accessing this
Sin
guide.
más, os voy a compartir mi pantalla para
With
daros
no more to
una
say, I'll
introducción
share
de
my
lo
screen
que
to briefly
pues puede significar
introduce
en nuestra región el trabajar en la
what
guía de acción, ¿no?
working
Ya
on
ha
this
comentado
action
Silvana
guide would
que
mean
actualmente, ¿me
in
dejan
our
ver si se ve
region.
la pantalla?
Silvana has already
Bien, ¿no?
said, can you see my screen? Yes, we
Perfecto.
can see it well. Thank
Pues
you.
sabemos que
Well, we
actualmente
know
en
that
el mundo
currently
tenemos 1,3
we
billones de
have
personas que
1.3
viven en el mundo con
billion people
discapacidad
who live
significativa.
with a
Esto viene a
significant
ser
disability
uno
in the
cada seis
world.
personas, lo
This is
cual
one in
pues
six
es un
people.
porcentaje bastante
This
alto.
is a very
En
high
nuestra región
percentage.
se está
In
hablando de que
our
en el año
region,
2021 de unos
in
85 millones de
2021,
personas
out of
que creemos que puede
85
ser ya
million
para el
people,
2025, para este mismo año,
and
unos
perhaps for
90 millones de personas,
2025,
tanto
it's
en
90
América
million
Latina como en
people,
el Caribe,
both in Latin America and
existe
the
una discapacidad
Caribbean. We
significativa.
have
Según el
14 to
IPC, tenemos
15
aproximadamente
people of the regional
3,14 del
population with a
15% de la
significant
población. Y se
disability.
estima que para el año
We estimate
2050
that
este
for
número suba hasta
2050,
150
this
millones de
figure
personas,
will
debido
increase to
sobre todo
150
tanto al
million,
envejecimiento de la
particularly
población
due to
como al
population
aumento de
aging
enfermedades no
and the
transmisibles.
increase of
Estos datos, por
non-communicable
supuesto, son
diseases,
imparables
NCDs.
y creo que es el
So
momento
these
de, sobre todo,
are data we
empezar
need
a
to take
implementar
into account to
mecanismos de
implement
abordar
tools
este problema.
that will tackle with
Sabemos hoy
this
en día que las
problem.
personas con
We
discapacidad
know that
tienen que
people with
experimentar numerosas
disabilities experience lots of
desigualdades que son
inequalities today.
evitables.
These
Por ejemplo,
inequalities
las
can
personas
be
con
prevented.
discapacidad pueden
Like,
morir
for
hasta
example,
20
they
años
can die
antes.
like
Las
20
personas con
years
discapacidad tienen
earlier.
peor salud y,
People
por
with
ejemplo, tienen el
disabilities
doble de
have
riesgo de sufrir
worse
depresión,
health. They have
incluso
twice
problemas
as much risk
cardiovasculares
of
y
suffering
enfermedades
depression,
reversibles.
ictus,
Y también las
cardiovascular
personas con
diseases,
discapacidad
and
experimentan una serie de limitaciones
communicable
en sus
diseases.
actividades de la
And
vida
they also
diaria y
experience
también no
limitations
tienen
in their
acceso
daily
a los
life
servicios de
activities and
salud y hasta
accessing
6 veces más
healthcare
a la hora de
services, and
operaciones
up to
sanitarias y
6 times more
asistencia
to
médica
access
muy
to health
accesible y asequible.
facilities and 15 times
Por
more
tanto, también
to
se denuncia
accessible
que existen
transportation. So we
desigualdades
can
en
see
el
there are a
manejo
number
a
of
nivel del país
gaps in
de las
how
enfermedades no
countries
transmisibles y
manage
también de las enfermedades transmisibles. Por
non-communicable
ejemplo,
and
las mujeres
communicable
con una
diseases.
discapacidad tienen
Like
menos
women with
riesgo, pero
disabilities
también
have
más
less than
posibilidades
twice
de
the
recibir una
possibilities
prueba
of
no rectal
receiving
para el cáncer
PAP
cervicuterino
tests
en
in
comparación con las mujeres sin
comparison with
discapacidad.
women
Lo
without
mismo ocurre,
disabilities.
por ejemplo,
The
cuando
same
hablamos
thing
de
goes
inmunización de
for
vacunas. Hay un vacío de un
basic
14%
immunization. There's a
para
gap
la
of
inmunización básica
14%
en niños de entre
for
24 a
immunization of
25 meses
children between
en
24 and
comparación con
35
aquellos niños que no
months
tienen
in
esta
comparison
discapacidad.
with those with no
Esto
disabilities.
es aplicable a todos los servicios de
This
salud
is
porque
applicable to
creo que
all
muchas
health
veces estamos
services.
queriendo reconstruir lo que ya tenemos
Oftentimes, we
ya y estamos
relate
con rehabilitación,
disability with
cuando realmente
rehabilitation,
abordar la
when
inclusión
actually
abarca muchísimo
it
más que
encompasses
la
much
rehabilitación
more
o
than
la
just
obtención de un derecho de apoyo
rehabilitation or
propiamente dicha. Por
providing
ejemplo,
support
embarazada, una mujer embarazada que tiene
object.
que necesita
A
recibir pruebas
pregnant
vaginales
woman who
¿Qué rol
is
desarrolla el
blind,
mundo
who
restaurativo
needs
que necesita la
maternal
prueba para
care,
distancia
a
para cáncer
deaf
de
man who
próstata,
needs
o un niño
a
con
prostate
discapacidad
cancer
intelectual
test,
que necesita
a girl
dispositivos de
with
fisioterapia,
intellectual
o una
disability who
mujer
needs
mayor
to
con
be
esquizofrenia
vaccinated,
que, por ejemplo, va al
or
ginecólogo.
an
Por lo tanto,
elderly woman who's
tenemos que tener en cuenta
schizophrenic and goes to a
cualquier tipo de
gynecologist.
intervención
So we have
o
to take
intervención
into account that this
conjuntamente
kind of
necesaria
intervention
y que
is
afecta a
totally
todas las condiciones de
cross-cutting
salud de
and
la
affects
persona.
all health
Los
conditions
principales
of
desafíos que nos
people.
estamos
The
encontrando
main
fueron tres
challenges
cuestiones
we
que se
find
remarcaron
um,
cuando se
yeah,
presentó en marzo el informe global, que es
have
que necesitamos un
conclusions. In
personal de
March,
salud
we concluded that we
capacitado,
need trained
habilitado y
healthcare
necesario
personnel
para abordar las
with the
necesidades
necessary
de las personas con
skills
discapacidad.
to tackle
En
with the
este
needs
sistema de
of people
salud,
with
que al estar tan
disabilities.
fragmentado,
We have a
tiene muchas
fragmented
dificultades
health
para
system, so
abordar
it's very difficult
íntegramente
to
las necesidades de las personas con discapacidad.
integrally
También hay un
address the needs
déficit
of
de
people with
conocimiento
disabilities.
sobre
Also,
el amplio
there's
enfoque de derechos humanos. Tenemos que
insufficient
pasar de un
acknowledgement
modelo
when we
médico a
talk
un modelo
with
más
the
basado
human
en
right
los derechos
approach.
humanos de
We
las
have to
personas
be
para garantizar el
based on
acceso.
human rights and not
Y por
only a
último, las
medical
barreras
model.
financieras,
Finally,
por
financial
supuesto, sin
barriers
financiación
that, of
exclusiva
course,
dedicada
without
a abordar este problema,
exclusive
probablemente esto va a ser una ecuación
financing that
que
is
se prolongará en
devoted
el tiempo.
to addressing this
¿Qué frutos de
problem,
la ley de
we
la guianza
won't be
podemos
able to
tener?
solve it.
Simplemente vamos a
So,
intentar cambiar la
what can we
narrativa, como hemos
expect?
hecho
We have to
anteriormente.
change our
Pasar de un
narrative,
modelo médico
going from
a
a
un modelo
medical
basado
model
en
to
derechos,
a model
de tal
based on
manera que
human
realmente
rights,
tengamos en
so
cuenta
that we take
el
into
acceso a los
account
servicios de salud como un
access to
derecho universal de la
healthcare
persona.
services
Tenemos
as
que
a
simplemente
universal
nuevamente
right of
cambiar ese
people.
modelo que
As we
todavía
said
tiene
before,
mucho de la
changing
rehabilitación
our
pura,
mindset.
una
It's not
progresión, un
only
apoyo a
rehabilitation
un
and
modelo, a
support
una visión
equipment,
de equidad en
it's
salud.
equity in health.
También queremos cambiar el
We
enfoque,
also want to change
no
the
pensar que
approach.
esto va a
We
ser
should
como un
not
gasto
think that
extra
this
en la
will
sociedad,
mean an extra
sino que realmente
expenditure in the
podemos dar
system,
un
but that
retorno de la inversión
there
cuando
is a
conseguimos
return
poner
on
el
investment
acceso
when
de estas personas
we
con discapacidad
include the
al sistema de salud.
people with
Por
disabilities in our
último, y a modo
healthcare
de conclusión,
systems.
os dejo aquí los
And
dos
as I said
QR
before,
para
you have
acceder
the
a los
two
manuales que están
QR
disponibles en
codes
nuestra
here to
página
have
web
access to
sobre la guía de
the
navegación en
manuals on
español
our
como
website,
en inglés.
both in Spanish and
Bueno, y
in
sin más
English.
dilación, voy a pasar ya
With
el
no more to
micrófono a mi
say,
colega Melanie
I
Gross del programa de
introduce
discapacidad
Melanie Grove
de
from
Ginebra
the
para que nos
Disability
hable
Program
de
in
qué pretende
Geneva
especialmente esta
that will
guía de
talk
acción.
about
Thank you very
the
much,
action
Melanie.
guide.
Over to you.
Thank you so much, Gustavo. Hello, everyone. Good morning, good afternoon, and good evening. Thank you for having me. It's a real pleasure and happy International Day of Persons with Disabilities. So my name is Melanie, and I am a consultant for the Disability Program of the World Health Organization. And I've been involved in the development and the publication of this guide for action for persons with disabilities. And today we are going to unpack this a little bit and look at all of its tools and what it can provide to member states and civil society organizations. Before I dive into the actual content,
We lost Melanie.
We lost Melanie for a second.
partners to look at health for all, to make sure that persons with disabilities healthcare services. In 2006 was a very big milestone because the UN
It seems Melanie's internet is
Apologies.
unstable.
COVID-19 pandemic hit us. That's where we saw a lot of very strong
Apologies. Apologies for the inconvenience.
during this time. And it's very much a wake-up call, this pandemic. So in May 2021, oh, I'm just getting a notification that my connection is not
Yeah,
good.
exactly. I don't know, maybe
Perhaps if you turn your camera off, Melanie.
maybe you can turn your camera off.
Apologies for that. I
And Melanie, if you could start also from the beginning, because it really was cutting and we didn't really understand from the beginning, that would be helpful. Thank you.
Yeah.
No worries. Apologies for that. I'm going to switch to and I'm turning my camera off. Okay, let me start again. All right. Hopefully you can hear me fine now.
Yes, it
Wonderful.
sounds better.
Wonderful, ma'am. Thank you.
Okay, perfect. Thank you so much, and sorry about that. So yeah, I was starting this presentation before going to the tool, very much wanting to set it in the context in which this toolkit was developed. So we know that all global health actors are very much striving for health for all, making sure that all the services that we provide are inclusive and accessible to everyone, including the most marginalized groups. And in 2006 was a big milestone for us because the UN Convention on the Rights of Persons with Disabilities was published and it's been ratified by most of the world's countries. And within this convention is Article 25, which very much sets health for persons with disabilities without discrimination as a key right. So we were making progress, we were in this very positive context, but as the years passed, we didn't see that much concrete improvements. And during the COVID-19 pandemic, we saw a lot of the inequities that happen to persons with disabilities. We saw that persons with disabilities were often not able to access the services to receive the care that they needed, or died much more than persons without disabilities. So that was very much a wake-up call for us. And in May 2021, member states adopted a very key resolution on the highest attainable standard of health for persons with disabilities. And this resolution was very much a game changer for us because it really puts the focus on this group and the specific action that needed to happen to make sure that persons with disabilities are included. Within the resolution were quite a few different requests that member states asked the DG, the Director General, and WHO to do. Among those requests were the Global Report on Health Equity for Persons with Disabilities that was published in December 2022, and that Gustavo already shared quite a bit of information about. So I'm not going to spend too much information, but this was very much a report that was the first of its kind to really unpack what is the situation on health for persons with disabilities. It provides the latest statistics on how many persons with disabilities in the world live, and this number is 1.3 billion. And that represents 1 in 6 people, which means that it's not a minority. And that's a very important number for us to be able to advocate and to make sure that our health services are accessible for persons with disabilities. And then we also unpacked a lot of evidence in the report on the health inequities. And I'm not going to repeat them because Sylvia and Gustavo already shared that very well. But we saw a massive discrepancy between the health outcomes of persons with disabilities and persons without disabilities. And what is really important to say is that these inequities are due to unfair and preventable factors that disproportionately impact persons with disabilities. So the good news within that is that it is preventable and there's a lot of things that we can do about it. As we are trying to get a better understanding of this context, the global report is unpacking all of the contributing factors to those health inequities. So we have the structural factors, and these factors are very much linked to the societal beliefs or the governance systems that regulate our societies. We also have the social determinants of health, and these have been shown to impact persons with disabilities a lot more. So here we're talking about issues such as poverty or limited access to education or limited opportunities to access employment. All of these impact persons with disabilities disproportionately compared to persons without disabilities. Then there is also another big category of risk factors that contribute to health inequities. So here we are talking about aspects such as living a sedentary life, obesity, or abuse of alcohol or other dangerous substances. All of this, again, we have noticed through the evidence that they disproportionately impact persons with disabilities, and that leads in consequence to poor health outcomes. And finally, and that's the one that I really want to focus on today, is the factors that are very much linked to the health system. And that's what we are going to look into, because that's what the Guide for Action very much targets. So as the global report unpacks all of the factors that contribute to health inequities, we also wanted to look at the solutions. And the big advice is very much to mainstream disability inclusion into the existing health systems. So not doing a set of activities that is very separate and distinct that we try to embed into the health systems, but very much looking at everything that already exists within the health systems, and within that, looking at how we can tailor specific actions to make sure that persons with disabilities are included. So the big framework that we came up with to advance health equity for persons with disabilities is looking at the 10 strategic entry points of the health system. So this is pretty much all of the pieces of the puzzle of what makes the health system. Things like governance, but also financing, the different models of care, healthcare workforce, or the physical infrastructures. All of these are the things that make up the health system. And within all of these strategic entry points can be some actions that we implement in order to promote inclusion and accessibility. So on this slide is a lot of, it's very busy, and I'm very aware of that. This is just to show you how within those 10 strategic entry points, in the report, we further develop specific actions that countries can take. And there's 40 of those actions. And we kind of see this a little bit like a menu of different actions that you can select depending on the opportunities that happen in the country. All right. But now that we developed all this framework, and we know the 40 key actions that member states can take forward to improve disability inclusion, we know that we also need to have a very concrete, very practical tool to accompany member states into this journey towards disability inclusion. And we cannot do everything. We cannot implement all 40 actions at once. So the Disability Inclusion Guide for Action is very much trying to fill this gap. So Gustavo already shared some information and the resources of the Guide for Action, and we can put the links in the chat as well. But in a nutshell, this is what it looks like. And what this tool is a process, a methodology to support the ministries of health to advance health equity for persons with disabilities. It's really providing a methodology, a step-by-step process to support member states to go on this journey, to be able to assess the situation of what's happening in the country and prioritize the specific actions that will lead to the maximum impact for persons with disabilities. Because as I said earlier, it's impossible to do all 40 actions. It's not even desirable. We need to start with something realistic. And this tool is very much supporting the member states to go on this journey towards finding this very realistic set of actions that will support disability inclusion in their health system. All right, so a question that we often get about this guide for action is, who is it for? And the answer is that ministries of health are very much the primary users. So we really need ministries of health to take the leadership because of their positionality in the health system, and they're making the decisions that will impact the health systems of tomorrow. So it's very important to have them take the leadership role in this process. But, and it's a very important but, the process involves many other stakeholders. It involves other ministries. For example, in some countries, we've worked very closely with the Ministry of Education or Transport or Social Affairs, who are very important in the field of disability. But also, we encourage a collaborative process with many other stakeholders, including civil society partners, organizations of persons with disabilities, and other intergovernmental agencies as well. So one very key feature of this guide for action is this collaborative process. So ministries of health are not alone. It's very much going on a journey together, still led by the Ministry of Health to see this process through, but in collaboration with many other actors that can help not only in the decision-making process and can input opportunities that may exist, but also in the implementation of these actions later on. And on this slide, you can see how this collaborative process looks like as we piloted the Guide for Action in Montenegro. And here we're very lucky to have a presenter later to talk about this process, but also from Tanzania. All right, so I've been talking a lot about this methodology or this process that we encourage member states to take on. And here are the 4 key steps that we recommend in this guide for action so that ministries of health can really embed and mainstream disability inclusion. The first one is a step of planning and consultation. So we're really getting ready. Here we encourage the development of the interest by the Ministry of Health, raising awareness of this guide for action, everyone being on the same page about what it entails, but also establishing this working group with lots of other stakeholders that will be key throughout the process. And finally, organizing a consultative meeting with everyone to be able to start to unpack why this agenda is important and what we need to do together as the next steps. So this is step 1. Then step 2 is a very important one. It's about providing a situation assessment. So here, it's a lot of different steps that we take on. We do some research, trying to find all the evidence about health equity for persons with disabilities in the country. We unpack the policies, how they are referencing or how they're accounting for persons with disabilities. Another big part of gathering the evidence is to do some interviews with key actors within the Ministry of Health, with healthcare workers, but also, very importantly, with persons with disabilities themselves. Then we also encourage people to do a lot of visits to the health centers and try to see what's working well, what's not working so well, etc. So it's a very thorough process, And there's lots of concrete tools within the toolkit to be able to go through this situation assessment. Then as a step 3, we have the development of the actions that need to happen. So we do encourage all of the people involved in this process to come together and with the results of this situation assessment to try to unpack which ones, which actions, or to be prioritized. And together weighing the pros and cons about which opportunities we need to focus on in the next year or 2 years, and starting to even add a budget to it to make it very concrete and very practical and to be implemented in a smoothless manner. Then there's the development of a monitoring framework as well. And there's a process to finalize and approve the action plan with recommendations from all the members of the working group that participate in this Guide for Action work. And finally, I'm reaching the 4th and final step, which is the implementation and the monitoring. So once we've agreed on which actions to take forward and what are the priorities that we will look at, there's the implementation of those actions. And there's also reviewing regularly if this is leading to impact. If yes, that's very good. We can continue in that direction. But if not, we can also adjust it. So it's a very agile and flexible process to make sure that we have the maximum impact. On this slide, you can see the countries that we've already started this work with. So there's Senegal, Cote d'Ivoire, Nigeria, Ethiopia, and Tanzania from Africa. In Europe, we have Montenegro, and in Southeast Asia, Nepal, and in the West Pacific, Malaysia went on this journey with us. As you can see, the Americas is a little bit white at the moment, but we're very much looking forward to having this discussion with you today and hopefully some interest. And we'll be very keen to collaborate with you if you're interested to go on this journey together. On this slide is a little bit of illustration of what this process can look like. This is pictures that were taken from the work of the implementation of the Guide for Action in Côte d'Ivoire. And this illustrates some of the actions within step 2, which is the situation assessment. So you can see on the first picture, for example, an interview with a group of people. So we did a lot of interviews, meeting ministries of health representatives, but also civil society partners. The second picture that you can see is actually my favorite one. It's when we met with a group of women with disabilities. And for a whole afternoon, we discussed their experiences of health and also their experiences of accessing different health services and what they wanted the Ministry of Health to do to improve their quality of life. Then on the third picture, it illustrates one of the visits that we did to a very new hospital in the capital of Côte d'Ivoire. And as we were visiting, we had that checklist that you can find in the Guide for Action, where we could see what's working well and what's not working so well. On the fourth picture is a workshop that we did with all of the working group of this Guide for Action, and we were discussing some of the priorities that we needed to follow through to implement in the future. And finally is a screenshot of the report of the work, and it's about 100 pages. So that's to tell you just how rich the conversations were and how much interest there was. All right, so I think I just have a few more minutes, and I just wanted to change the topic very briefly and just for a few minutes to tell you about one of the newest initiative of the World Health Organization, which is the WHO Disability Health Equity Initiative. And within this initiative, which very much aims to advance health equity for persons with disabilities, we just launched a new network, which is bringing together health and disability stakeholders under this common vision and mission of advancing health equity for persons with disabilities. The objectives are to bring people under this common understanding and narrative of what we need to do to advance health equity for persons with disabilities, but also to coordinate the advocacy to make sure that those messages are shared and understood by everyone. And finally, to facilitate this knowledge sharing around the topic. So in June and July and even August this year, we launched the network's first call for membership applications. And we were very pleased by the interest that it generated. We had over 1,000 expressions of interest. Within that, 272 organizations completed a full application that was reviewed, and 154 members were approved in the end. And you can see the distribution of those organizations on the world map here, with actually a very good representation from the US and Canada, but also Chile and Peru. Within this network, we have a lot of different stakeholders, included 33 member states, but also 14 intergovernmental organizations, including UNICEF, OHCHR, and the World Bank, and as well a very large number of civil society organizations, including organizations of persons with disabilities themselves, such as IDA, the International Disability Alliance, and also many partners from academia and the private sector. So, and this is probably my last slide, the strategic pillars, the blueprints, and the areas of work that this network is going to work on. We have four of them. Firstly is to build the leadership on health equity among persons with disabilities. Number two is to elevate health equity for persons with disabilities as a political priority in health. The third pillar is to create a disability inclusive health sector. So that resonates a lot with the Disability Inclusion Guide for Action that we just talked about today. And the last one is to establish robust indicators, evidence, and monitoring. All right, I'm coming to the end of the presentation. Thank you so much for your attention. And on this slide, you can see a QR code leading you to more resources. There's also our contact details, so please don't hesitate to contact us. Thank you so much. Over to you, Gustavo.
Thank you very much, merci. Muchas gracias, Melanie, por la excelente presentación. Bueno, creo que nos
Thank you
has
very
presentado
much,
muy
Melanie,
bien
for this
cómo
excellent
consiste
presentation. I think that you
precisamente esta
have
guía de acción,
presented very well
cuáles son los pasos que hay
this
que implementar
action guide.
y
What are
bueno,
the steps that
realmente
need
que
to
se
be
necesita que
implemented?
todos los
And
actores
also what
contribuyan de
is
una manera u
needed
otra
from all the different players
en
that
hacer los
intervene
servicios de salud
in one
más
way or the other
inclusivos y
so that
accesibles. Muchísimas gracias,
health
Melanie.
services can be
Bueno,
more
pues vamos a
inclusive.
pasar de las
Thank you
palabras
very
a
much,
los
Melanie.
hechos.
And now let's go
Creo que
from
es
words to
importante saber
facts.
cómo se ha
I think
pilotado
that
en
it's
otras
important to know
otros
how
países.
this experience
Tenemos que
has been
darle la
piloted
vuelta a
in
ese
other
mapa que
countries.
hemos visto de
We
las
need
Américas, donde
to
todavía no se ha
turn
hecho.
around
O
that
sea
map
que
of the
creo que es
Americas
una buena
where nothing
oportunidad que
has been done
tenemos
yet.
ahora.
And so I
Voy a
think that we have a
presentar
good
a la
opportunity here.
doctora
I'm
Mina
going to
Brajovic.
introduce
Ella es la
Dr.
representante de la Organización
Mina
Mundial de la Salud
Brajovic.
en
She
Montenegro
represents
para que nos
WHO in
explique
Montenegro,
cómo ha
and she
sido
can
el
explain
proceso de
how
elaboración
the
y de desarrollo
process
de
of
esta guía de acción
implementation
en
and
Montenegro.
development of this action guide has been
Tenemos a la
in
doctora
Montevideo. We
Mina
have
para
Dr.
breve.
Mina, we'll have
Un
Dr.
segundito,
Mina
por favor.
briefly.
Aquí está ya. Doctora Mina,
Hello,
thank you very much
everyone.
for
Dr.
participating.
Mina.
The floor is yours. Thank you very much.
I hope you can hear me. I don't know whether there are any issues with respect to the connection and whether I should also maybe disconnect my video because obviously Melanie was having some issues until she switched off the video. So I
So
am
far, we
Gustavo.
can see you, we can hear you quite well.
Okay, okay. Then I move on, and if we
Great.
experience any issues, you just notify me, let me know, whatever way. So once
Perfect. Thank
again,
you.
it's really wonderful to be with you, and I really feel privileged for various reasons to share with you experience from Montenegro, a very small country from the region of European region. And when I say very small country, I mean that Montenegro has 0.6 million inhabitants. So this is also one of the reasons why I even feel, as I said, proud and privileged that through this experience, we are also demonstrating that a small country such as Montenegro can be actually an incubator of knowledge and good practice that could be actually shared generously with other member states to promote our joint agenda and actually deliver on our promise when it comes to delivering on universal health coverage. So, as Gustavo already mentioned and Melanie, Montenegro completed basically this WHO Disability Inclusion Guide for Action process. And I would say that we managed to complete it during one of the probably most dynamic political periods in recent years in Montenegro, marked by three government changes, shifting priorities, and institutional transitions. In a small country that is a young democracy that doesn't have a professional public administration, believe me, it was a real and sometimes it looked like unsurmountable challenge. And yet, this process not only survived those cycles of changes, but it became, in a way, even a stabilizing force, helping the Ministry of Health itself to anchor its work, number one, in evidence, in human rights, and broad partnerships. And I think this is also one of the lessons learned how this type of complex processes should be actually managed. And if you would ask me to share with you what was, let's say, the key defining attribute of this process, I would tell you partnership. Partnership is something that truly powered our work throughout the whole process. And basically, by mobilizing expertise also across all three levels of WHO, World Health Organization, and working side by side with Ministry of Health, we actually ensured this continuity despite political changes. So eventually, when we started this assessment in 23, and basically when we completed it, it provided Montenegro with an objective and evidence-based map where inequities lie. And what is equally important is that where interventions would have the greatest impact. Because, you know, in a small country with limited resources, not only money, but also human resources, it is really very important to have a list of your priorities carefully crafted. So basically, to sum up, solid evidence became our strongest tool. And it helped us, number one, weather these political transitions without losing the momentum, because all of us who are working with administrations, we know that when you are once on the wave, you better use it, because it is really then questionable when the next one will come. Number two, this evidence also helped us open the door to high-level dialogue with minister, but also with parliamentarians and stakeholders across different sectors. And number three, it also this comprehensive assessment helped us shift the conversation, because you know when decision makers receive clear and evidence-based findings, then really that is a game changer. Then really the weight of evidence cannot be diluted by political changes that I mentioned actually at the very beginning of my intervention. So this process, the overall process of the assessment, basically aligned with Montenegro, strong commitment, I would say, to universal health coverage. Namely, in 23, the government, one of the governments, actually adopted a national health sector development strategy, which was developed with WHO support. We really had privilege to work with the government and help them develop this strategic document. And this strategy explicitly prioritized that, number one, improving health equity for persons with disabilities is actually one of their priorities, and reducing discrimination and barriers in access to health services they recognize as their explicit priority. So actually, this strategy had a flagship intervention, and this strategy in 23 that was developed with us, with our support, basically was the assessment of health system inequities experienced by persons with disabilities, which then directly informed development of the first ever national action plan for reducing health inequities for persons with disabilities in Montenegro. And Montenegro is actually the first country in the whole WHO European region to use this guide for action. So Montenegro, in a way, I have to say that basically positioned itself as a global leader in health equity. And it also helped Montenegro align with European Union global health strategy. And this is for Montenegro super important because Montenegro national strategic foreign policy priority is actually accession to the European Union. So overall, the whole process of the assessment and developing the action plan was actually number one, participatory, and was super comprehensive, a true whole of society effort. It took us a lot of efforts, but it was worth of the investment. And basically, the Ministry of Health, as we agreed at the very, very beginning, basically established and convened a multi-sectoral working group that included government institutions, but also UN partners, national stakeholders, and what was critical, organizations of persons with disabilities. Because it is really very true.
Sorry,
that
Dr. Abrajovic, could you just speak a little bit slower so there
Oh,
we give
yes.
time to interpreters? Sorry.
Yes,
Thank you.
absolutely.
Thank
I
you so much.
apologize.
Apologies for interrupting you.
I apologize. Thank you. So basically, the Ministry of Health established this multi-sectoral working group, which included relevant partners and stakeholders. And particularly what was crucial was that in that working group, we actually included persons that are representing actually those who live with disabilities. And it is very true that nothing about persons with disabilities should ever be developed without their engagement. So this collaboration that was institutionalized actually through this working group basically ensured that there was across sectors, across society, shared understanding of the critical gaps. Number two, we generated consensus of what are the priorities and priority actions. And number three, we also created together, we developed context-specific activities. And now Montenegro is actually expected to move into the stage of implementation. So I would say that now this engagement of all national stakeholders will be essential. So in short, basically, really, public health for everyone starts with inclusion. And I think that based on this experience with the assessment and drafting this plan and institutionalizing this collaboration, I would say that Montenegro has laid down a strong, evidence-based and politically resilient foundation to ensure that really no one is left behind. And if I, as head of office, and by the way, I also have to tell you that I'm one of very few in the Euro region who has that privilege to represent WHO in the home country. So I'm also Montenegrin. So as a professional and also as a Montenegrin, heavily engaged in this process, if I had to choose one action, it would be this. It would be the following: to engage persons with disabilities and organizations that represent them from the very, very beginning and keep them engaged throughout literally every step. Disability inclusive health system is actually only as strong as its core components. And Melanie was also addressing this issue a bit in her presentation. It is governance, it is financing, data, evidence, it is service delivery, just to name some of them, and ensuring that every component is addressed It really requires that participatory process. And that participatory process always has to be grounded in shared framework, and it has to be built on meaningful dialogue with those who are heavily affected. Otherwise, you can really not get even the right understanding of the gaps in those priorities. And countries that genuinely want to ensure that no one is left behind, they really, as I said, maybe I'm repeating myself, but honestly, I think for us that was the lesson learned. They must bring persons with disabilities to the table. They have to engage them in gaps assessment. They have to involve them in decision making, and they have to collaborate with them in designing and implementing and monitoring this type of interventions that actually have the transformational impact for the overall system and bringing benefit for the whole population, actually. So this inclusive approach, I would say, is a sort of a guarantee that priorities are accurate, that our solutions are realistic and feasible, and that the system actually becomes stronger and more equitable as a whole. Because really, inclusion is not an add-on. It is actually the foundation for a resilient, for trustworthy, and actually truly universal health system. Over. Thank you.
Thank you. Thank you very much, doctora Brajovic. Muchísimas gracias por su intervención. Bueno, pues creo que ha expuesto sobre la mesa cómo ha sido realmente el proceso de implementación de la guía. Creo que antes de terminar tenemos
I think you
unas
have really talked
preguntas
about
en la
the
caja de
guide
preguntas de respuesta.
implementation.
Por
Thank
favor,
you
si hay
very
alguna
much.
más,
And
pueden escribirlas. La primera pues sería pues tanto para Melanie como para la doctora Mina Brajovic.
the first question would be for Melanie and for
Nos pide
Dr.
un
Mina
consejo
Brajovic.
práctico o
They're
una
asking
recomendación
for a
específica
practical
para el
advice
personal
or
que trabaja
recommendation
como
for
cuerpo
the
laboral,
personnel
para
that
el personal de
works
salud.
as
Y
a
también nos
labor force
preguntan
in the
por qué
healthcare
esta
system.
guía es para los
And
tomadores de decisiones, para los policymakers.
because this
Muy,
guide
muy
is
buena
for
pregunta.
policymakers. And so this is a
Adelante,
very
Melanie,
good
adelante, doctora
question.
Brajovic.
Please go ahead,
Thank you. Yeah, I'm
Dr.
happy to provide a few
Brajovic.
pointers for that question. It's a very, very good question. And as we said in the presentations, this process really brings together a lot of different stakeholders, and people who are working within the system are actually extremely important and have a key role in this. As practical recommendations, I would say and recommend first and foremost that health sector partners can play that critical role at the inception of the work, just to raise awareness about this guide to the ministries of health and senior leadership, to really promote this understanding, to have those discussions about the challenges that exist, and also promote the buy-in into this disability inclusion guide for action. Then, when we do have the buy-in and the ministries of health are starting this journey and are starting to implement the guide for action, there's a lot of opportunities for healthcare workers and people working within health services to really input to, I think phase 2 is a very critical phase, the assessment phase. So you could, for example, help by sharing testimonies that can be inputted into the report of that situation assessment, but also open the doors for the visits that we do to be able to see what's accessible and what's not accessible on the ground. And providing some of the key policies that are in place in the health systems. So your role would be very, very critical in that phase of the report. And then as we reach perhaps the end of the process during phase number 4 about the monitoring and evaluation, I think you would be very well positioned to be able to share that data. Is it working well? Is it not working so well? Do we need to adjust the process? So these are perhaps a few phases that where your role might be very, very helpful, but there's probably a lot more.
Muchas gracias, Melanie. No sé si la doctora Brajovic quiere añadir
Thank you very
alguna
much,
punto más.
Melanie. And I don't know if Dr. Brajovic wants to add something regarding this question.
Well, given the fact that Melanie's answer was really very comprehensive, and
Mm.
that I don't want to take our time and of our
Okay.
colleagues who actually joined this webinar, I'll try to be very brief and say that being a small country, we didn't have that luxury to ensure that in this stage of running the assessment and then also developing the plan, that we have only policymakers. It was inevitable for us to have let's say a sort and take a blended approach, meaning that we had some of them who were policymakers, and we also had privilege, I would say, to have those who were from the first line of defense, meaning healthcare providers, and that proved to be actually a refreshing kind of factor for the overall process of assessment, because
Mhm.
it always gave us a fresh perspective, a very realistic look and perspective on the system, how it is performing, challenges and gaps, and how things operate actually, and brought us closer, because sometimes when you're a policy maker, then you tend to be even disconnected a little bit from the reality. And then
Mhm.
on the other hand, I would say that it was healthy to have actually healthcare provider from the first line of defense and healthcare service delivery, because it was also an entry point from the very beginning to start actually sensitizing even healthcare workers, start sharing relevant information, having them on board from the very beginning, because if you don't have healthcare providers on board, then you cannot have actually successful implementation of your interventions later on. So I think it would be always good that those two processes of designing and then
Mhm.
preparing your teams to implement are somehow interconnected, and that's why for us it worked really very well that it was an integrated team consisting of policymakers and also the healthcare providers. Over.
Muchísimas gracias. Sí, a mí me gusta decir que se trata de un doble enfoque, ¿no?
Thank you
Desde
very much.
arriba
It's
hacia
a double
abajo, vamos a
approach,
decirlo, pero
top
también de abajo hacia
down,
arriba, de top
but
down y
also
bottom up,
bottom up.
de tal manera que todos en algún momento
And so
del proceso,
everyone
como ha
at some
comentado
point of the
la doctora
process, as
Rodríguez,
Melanie
van a estar
said,
involucrados a la hora
are
de luego
going to
realizar
be
esta
intervención.
intervención.
When it
Es
comes to
verdad que la
implementing this
iniciativa tiene que
process.
partir de
It
una
is true
petición
that the
concreta y válida,
initiative
¿no?
has to come
Pero
from
al fin y al cabo todos
countries'
grupos
requests, but in the end,
multisectorial y todos acaban
uh,
involucrados. Creo que
at
tenemos
the
tiempo
end,
para
everyone has to
una
be
segunda
involved.
pregunta
And I think that
y la
we have
pregunta
time
está
for a second
relacionada con el
question, and
uso
the question is related with the use
ICF, a ver un segundito, efectivamente, de la clasificación internacional del funcionamiento.
of the
¿Y cómo puede o
international
cuál es el papel
functioning
dentro
classification.
de
What
la
is the
guía de
role
acción de
of
la clasificación
the action
internacional
guide
del
of the
funcionamiento,
international
siendo este el
functioning
estándar
guide?
que se usa para valorar la
Uh,
discapacidad?
since this is a standard that is used to assess disability
Teniendo en cuenta que también
or
incluye
to
un
weigh
enfoque
disability. And
biopsicosocial,
this
¿no? Cuando
has
hablamos
a
del ICF, ¿no? Tiene un
biopsychosocial
enfoque
approach.
biopsicosocial y por eso preguntan
Yes, this
cómo
is
se
biosocial
inserta
approach, biopsychosocial
esta
approach, and this is why they
clasificación
ask how
dentro
this
de la guía de acción.
classification is inserted in the practical guide.
Thank you. I'm happy to provide a few points for answering that question. I think so. The ICF, the International Classification of Functioning, Disability, and Health, is a tool that was developed by WHO to conceptualize disability as not just the health condition, but very much a very dynamic process with the environmental factors and personal factors of a person. So it gives this much richer, more holistic understanding of where disability emerges, not reducing it to the medical model of like just the health condition. But the guide for action is quite distinct and quite separate because it's very much a toolkit that looks at reforming the health system. So you're very much looking at on the ICF, the conceptualization of disability, and we're still following this line of thinking. But the Disability Inclusion Guide for Action very much looks at transforming the health system to make it more inclusive. So we're looking at very different sets of priorities. And yeah, so they're quite distinct in this. They still work very well together, but we do not reference the ICF within the Disability Inclusion Guide for Action, for example.
Voy a hacerle una pregunta a la doctora Mina Brajovic, una pregunta que creo que es muy interesante.
Going to ask
Preguntan
this question to Dr.
cómo se
Mina
logra
Bradovic.
involucrar
I think it's
a
very
las
interesting. How can
autoridades
we involve
gubernamentales en este cambio
governmental
de enfoque.
authorities in this
¿Cómo en Montenegro ha sido esto
change of
posible?
approach? How was this possible in Montenegro?
Well, as I've actually mentioned, we actually relied very much on the power of evidence. That's why for us the logic was do the comprehensive assessment because we knew that only if you have strong evidence and solid findings, it will help us actually initiate and have dialogue with the relevant people in the country, regardless of those changes. Number two, we contextualized actually our work in the sense that we related it to international ratified conventions and we related it also to relevant political processes that are undergoing in the country, demonstrating that when the government is working to advance the health equity agenda, they are also advancing the political agenda, the agenda on delivering SDGs, the agenda on the national prosperity. So that's why it's really very important whenever you have to deal with politicians, and all ministers are politicians number one, and then everything else. It is really crucial to contextualize your work and to contextualize your intervention, and particularly when you need to bring several of them around the table and to ensure their support and their commitment. It is always very important to articulate clearly what is it there in it in that agenda for them, and how that agenda will also help accelerate delivery and accomplishment of their agenda, meaning that this should be actually everybody's agenda. But I would say that the greatest power stems from partnership and it stems from evidence.
Muchísimas gracias, doctora Brajovic, por sus
Thank you very
comentarios.
much,
Creo que
Dr.
tenemos tiempo
Bradovich, for your
para una
comments.
última
I
pregunta
think we have time for a
en
last
relación a la
question
integración de
in
esta
connection
herramienta,
to
si tiene
integrating
alguna
this
relación
tool.
con la herramienta ya
Does it have any
implementada en 2010
relationship with
sobre
the
rehabilitación basada en
tool
la
published
comunidad.
in
Bueno, yo creo que son diferentes
2010
herramientas, pero
about
os cedo la pregunta a vosotros, Melanie. ¿Hay alguna
being
relación
based on the
entre esta guía,
community?
esta herramienta
Melanie,
y
is there a
la
relationship between
herramienta que
this
nos
guide
ayudan
and
sobre
the
la rehabilitación
tool
basada en la comunidad?
mentioned
Muchas gracias.
on realization based
Thank you
on the
so much.
community?
I'm not entirely familiar with this guide for action, but my understanding, and again, I'll probably have to double check and get back to you for a very clear answer. But my understanding is that the other guide that you mentioned is looking at strengthening rehabilitation, and that's very much the focus. Rehabilitation being very much one type of services within the entire health system that benefits persons with disabilities a lot, including providing physiotherapy, speech and language therapy, and all of those services, which is very important. What the Disability Inclusion Guide for Action does differently is that it's looking at the entirety of the health system and all of the health services. So including rehabilitation services, but also sexual and reproductive health services, NCD services, cancer care, diabetes. All of what makes up the health system pretty much is targeted, and we're looking at the systemic entry points to mainstream disability inclusion throughout. So this is, I think, where the difference would stand.
Perfecto. Muchísimas gracias, Melanie.
Thank you.
Very well, thank you very
A
much,
ver si hay alguna
Melanie.
pregunta más. Creo que no
I
veo
think
ninguna pregunta más, efectivamente.
there are no more
Bueno,
questions.
pues
Well, in fact,
yo creo que
no.
ha sido
So
un
I think
webinar, una
this
sesión
has
muy
been
interesante de
a very
presentación.
interesting
Creo
webinar,
que, como
great
hemos dicho anteriormente,
presentations.
nos
As
toca
we
darle la
said
vuelta al
before,
mapa.
we have to turn the map around and try to have the Americas with more signals. So the next webinar, you have lots of countries in our region, and that it is us who can export these experiences. I'd like to tell you that the recording of this video will be available on our website probably this afternoon or tomorrow. It'll be available for all those who weren't able to access this webinar. Or if you want to see it again, I'll also put my email on the chat. So any ministries or secretariats interested in implementing this action guide, I'm available for solving your doubts and to start implementing it, of course. The PAHO director and our unit director addressed the floor at the beginning, and also Dr. Brajovic, thank you very much for attending this webinar on the Day of Persons with Disability. A key point, let's make an inclusive activity today. So this is a better world for people with disabilities. Thank you very
Muchas
much. See you next
gracias.
time.
Gracias,
Thank you
Gustavo.
very much. Thank you, Gustavo.
Ciao, que tengan un buen día.
Muchas
Bye-bye.
gracias.
Have a good
International Day of
day.
Persons with Disabilities.
Thank you very much. You have
Thank
my
you.
email, tenéis mi correo electrónico. Nos vemos en la próxima.
Great, thank
You have
you.
my
Thank
email.
you.
See you
Chao,
next
chao.
time.
Thank you,
Thank
Melanie.
you.
Thank you, Dr.
Bye-bye.
Brajovic.